Welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're going to be showcasing a brand new tracker on hawaiihealthmatters.org, the Healthy Brain Tracker. This tracker is the result of a collaboration between the University of Hawaii's Thompson School of Social Work and Public Health Center on Aging, building our largest dementia infrastructure team, along with the Executive Office on Aging and the Hawaii Health Data Warehouse. Additionally, a data action team from the Hawaii Dementia Initiative provided their expertise to help create this tracker. The Healthy Brain Tracker supports the Hawaii 2035 State Strategic Plan on Alzheimer's disease and related dementias. You can find a link to the state strategic plan on the landing page for the Healthy Brain Tracker, and you'll see that the report is a blueprint to strengthen the capacity of our state agencies and community partners to build a strong infrastructure that will reduce the risk of cognitive decline, promote healthy brain development, and support caregivers who are caring for individuals living with dementia. It's aligned with the CDC Healthy Brain Initiative roadmap. Here's their mission. I will just read it quickly. So we are committed to embrace and support with aloha all of Hawaii's people who are touched by Alzheimer's disease and related dementia, from prevention and early detection to end of life, always keeping alive the hope of an eventual cure and aiming for the best quality of life for all. The plan outlines many goals with strategies and action items. These are organized across 4 public health domains: data, program and policy change, public awareness and education, and workforce development. It's a very well organized and detailed plan, and I definitely recommend taking a look at it. But let's talk about the tracker. So the Healthy Brain Tracker was launched on hawaiihealthmatters.org on May 1st. It organizes 36 indicators around dementia, cognition, and caregiving into 4 topic areas. It contains data from the Behavioral Risk Factor Surveillance System, or BRFSS, the Vital Statistics, and the Centers for Medicare and Medicaid Services. To help users navigate the tracker, the indicators are divided into 4 topic areas, including cognition, dementia prevalence and mortality, dementia risk factors, and caregiving. Here's a sneak peek at what we'll see in the Healthy Brain Tracker. So for the first topic, there are 12 indicators around cognition. And this section pulls heavily from the BRFSS cognitive decline module. So I thought it might be interesting to let you know, the module is only asked of adults 45 years and older. And then the first question reads, during the past 12 months, have you experienced confusion or memory loss that is happening more or getting worse? And then the subsequent questions assess the measure of severity of the topic decline. The second topic area, dementia prevalence and mortality, has 2 indicators that look at the prevalence of dementia in the population and the mortality rate for Alzheimer's disease. The third topic area explores risk factors for dementia among adults 45 years and older. These risk factors cover a range of areas, including chronic conditions, injury, physical activity, substance use, and sleep. The last topic area includes 11 indicators around caregiving. This is another example of pulling from a BRFSS module, the caregiving module. This is asked of all adults, and the first question reads, during the past 30 days, did you provide regular care or assistance to a friend or family member who has a health problem or disability? It then goes on to ask 9 further questions, both the caregiver and the person being cared for. For the Healthy Brain Tracker, we focus on caregivers of people living with dementia. You can access the Healthy Brain Tracker on Hawaii Health Matters in 2 ways. First, if you hover over the Data Trackers tab on any page of the website, a drop-down will appear with all the available trackers, and you can click on the Healthy Brain Tracker to get there. Alternatively, if you click on Data Trackers, it will open a landing page displaying all the available trackers, and you'll see the Healthy Brain Tracker right there in the first spot. Before we go to the demo, I just want to go over some basics for Hawaii Health Matters for people who maybe aren't familiar with the site. Hawaii Health Matters, or HHM, is a great source for data when numbers might not be your first love. It provides a lot of comparison data and links to resources that help you put the data in context. So the site uses comparison data and icons that incorporate colors and symbols to help users interpret the point estimate. In general, red is bad, green is good, and blue is neutral. When you see a solid box with an arrow, that tells you there's a statistically significant trend. When the box is mostly white, it's a trend but has not reached statistical significance. Many of the indicators on HHM also have target values, so you can see easily which ones we've met with the green check, and those we still need to work on with the red check. I'm going to go ahead and go to the demo. Here is our hawaiihealthmatters.org landing page. And you'll see that our Healthy Brain Tracker is prominently featured as our featured content for this month. Each month we choose a different featured content. This rotating banner also lets you know about recent data releases, and this is also where you can register for the coffee breaks. Below that, we have just a little information about the site, a link for more information. And then below that, we have this mini dashboard. So this is our focus on dashboard. This changes every month too. So we pull in indicators that are relevant to our featured content to give users an idea of the kinds of things that they will see in the tracker. And then of course, there's an easy link or learning more, which also provides additional information. So let's take a look at the Healthy Brain Tracker. So we can see it here, but I'll show it to you also on the data tracking page. Here is our Healthy Brain Tracker. So you'll see the top part is really a summary of the tracker, and it talks about the state strategic plan and the overall goal of this tracker, which really is intended to guide key stakeholders and the general public as we move forward in implementation of the state strategic plan. Okay, right below that, we start to get into the data. So the first thing you'll see is a geography selection. So if you're coming here from a particular county or you're only interested in data from a certain county, you can go ahead and select that here, and this page will refresh and show you the data for that county. I'm going to leave it on state for now. There's also a colorblind mode, which uses these little thumbs up and thumbs down icons. And there's an alternate way to look at the indicators. They call this the card view. Personally, I'm a fan of the line view, so I'm going to put it back. And then we get into the different sections of the tracker. So the first section here is cognition, and you can see a lot of the indicators that are available. You can automatically see the point estimate, comparison to prior values, and for some of them, trends. And then we get into dementia prevalence or mortality. After that is dementia risk factors. And this is where they cover a lot of chronic disease and injury, tobacco use. And then the last topic area, which is caregiving. And again, this is really focused on people who are caregiving for someone with dementia. Okay, back to the top. Let's take a closer look at one of these indicators. We're going to look at this one, adults 45 plus with cognitive decline. We can see already the point estimate for 2021 is 11.1%. That is higher than the last value, which is bad. So that's why this is red, but it's trending down overall, which is good. Let's take a look at what we see when we click on this. Now we can get all of the detailed information for this measure. Again, there's a geography selection here. You can also look at older data here. But probably one of the more important things is this definition. Since this is a survey, a measure from a survey, this will pull from the survey question. So you know exactly what the person was asked, and you can understand what's being measured. So here we see that experience confusion or memory loss that is happening more often or getting worse. Okay, below that, we have a little bit of the public health importance of this measure. And then we get into the data. So we can see here that for 2021, 11.1% of adults 45 and over reported that they had experienced confusion or memory loss that is happening more often and getting worse in the past 12 months. So that's great, good to know. But how does that really compare? What does that mean? So that's where Hawaii Health Matters offers these comparison values to give you an idea. In this case, we were unable to get the national data, but we do have comparisons within the states. So it is significantly higher than the prior value, but it is trending down. And you'll see these little boxes appear anytime I hover over one of these icons to give you a little more information. There's a legend that's always available on the left-hand side. So if you see something and need a reminder, go ahead and check there. Oh, and for those of you who are familiar with hhdw.org, you might be interested to know that for these indicators that come from data sources that we have in hhdw.org, that link there will take you directly to that indicator in hhdw, where you can start to do your own modifications to get the data how you want to see it. If you're interested in that and don't know much about it, check out our YouTube channel. We do have some webinars on it. Okay, so back to Hawaii Health Matters. Below the comparison data is where we see the trend data. And you can see there was quite a jump between 2020 and 2021, but the trend, which takes into account the last 4 data points, sort of is going down. So you can download this graph as a JPEG or PDF. You can download the underlying CSV. There's a few options for confidence intervals. You can play around with how you see the data in that map. Below the trend data, we get to the subgroup data. So this is going to show you the measure broken out by a variety of sociodemographic characteristics. Here we can see the rate of adults 45 plus with cognitive decline by age, by education level, employment status, percent of federal poverty level. Here's race, ethnicity, sex, and sexual orientation. So that just gives you a broad range of options to look at how that data is distributed differently across the population. Below that is where we'll see a geography tab. And this will show us now the data across all 4 counties. So it ranks it from lowest to highest. You'll see there's a nice interactive feature between the graph and the map. You can put comparison values on the graph. And then there's also a data table. And this, of course, can be downloaded as a CSV. So this is a good way to look at comparisons of geography. Okay, below that, we'll see a link to the more information about the data source. And then below that is sort of another special thing about Hawaii Health Matters. We have a reports and publications library, and we really try to keep it well stocked. In fact, if you have suggestions for anything, you can let us know. And what the system will do is pull up related resources. So we can see there's related indicators, reports, fact sheets, plans, and funding opportunities. Hawaii Health Matters is a great place to start when you're looking at what's out there. Okay, what I want to do is look at an indicator from a different data source, just to give you an idea of the differences you might see. So we're going to go down here to Alzheimer's disease death rate. Again, we have the geography and the time period. The death rate indicators are usually age adjusted, and it gives you the ICD-10 code that was used. Again, a little bit of public health importance, and then we get into the data. So we can see for 2023 in Hawaii, there were 21.4 deaths per 100,000 population due to Alzheimer's disease. And in this case, we are able to compare to a US value, which is actually higher, considerably higher than ours at 36. So that's why this icon is green, because our value is good. It's lower. We can see there's not a significant change from the prior value, but it is trending up, and it's actually a statistically significant trend. So again, here you can click here, and this will take you to HHDW, but we're not able to link to specific ICD codes. So it just takes you to the data sources. And then we see here again the trend data. You can get confidence intervals by hovering over the graph. And then below that, we have some subgroups. You might notice there's not as many for this indicator as the one that we looked at before. And that's because this indicator comes from vital statistics, and we're not able to break out the data as much as we can when it comes from BRFSS. So depending on the data source, you'll see different number of age groups here. But you can see here we have it by age, we've got it by race, ethnicity, and by sex. And you're seeing these different colors here because the system actually does some basic statistics for you. So in this case, when you see a green bar, it means that that value is significantly better than the overall state value. And the opposite with the red, it's significantly worse than the overall state value. So that gives you an idea of another data source. You can look at it by county, the data sources here, and our related indicators. I'm going to run through one more real quick because I feel like this caregiving section really is pretty unique. So let's look at adults who care for someone living with dementia among caregivers. So again, geography and period. This definition is a bit longer because it is a survey question that's only asked of a certain subset. So this indicator shows the percent of adults who provided care to someone in the past 30 days who had Alzheimer's disease, dementia, or other cognitive impairment disorder. And this is among adults who provided regular care or assistance to a friend or family member who had a health problem or disability. So this set of indicators, what we've done is filtered it out so that the person receiving care is living with dementia. So in this case, this is just among all caregivers. And we can see that over a quarter of people who are providing care for friends and family members are doing so because of a dementia-related disability. We can see here the prior value hasn't changed much. And we don't get a trend here again because I think I mentioned it requires 4 data points. So the next time this question is asked, we'll be able to get a trend. But we still can get the data by breakout groups. I wanted to just show you really quickly the reports and publications. So this is a great resource library, and you can just do keyword searching, and it'll pull up all the things related to your keyword. So we've got different plans and reports. It also has things like data websites and infographics. So keep that in mind if you're ever looking for information about a particular topic. Now I want to give you some time for hands-on work. So take a few minutes to explore the Healthy Brain Tracker on Hawaii Health Matters and answer these questions. Okay, let's go ahead and go through these. So the first question asks, how has the rate of adults 45 plus with cognitive decline who discussed it with a healthcare provider, how has that indicator changed over time for the state? So we'll go back to our Healthy Brain Tracker. We know that that is a cognition indicator, and it's asking about adults with cognitive decline who discussed it with their healthcare provider. So you can see here the current value is 32.4%, but we already have a peek at what it's doing. It looks like it's trending down. So let's take a look at that graph that has the data points over time. And you can see, yeah, there was a big drop between 2015 and 2017, and then it looks like it's continued to kind of drop after that. So the answer would be that it is declining significantly. Okay, the next question, I'm just going to read it. Which county had the highest rate of death due to Alzheimer's disease in 2023? So we will again go back to our tracker. This is one that we actually did look at. So this is Alzheimer's disease death rate. And it's asking which county had the highest rate of death due to Alzheimer's disease in 2023. So as I mentioned, you can filter the data to specific counties, but if you want to see all the counties, you need to select it from down here. This is where the mapping function pulls up that really nice chart. So here we will see the different 4 major counties in Hawaii ranked from lowest to highest, and we'll see that Kauai actually has the highest. The question does have a second part. It says, how does this compare to previous rates for this county? So if you wanted to see data specific for Kauai, you can just click on that bar, and now you'll see the trend data for Kauai. And you can see that this is also trending up, although not statistically. You can compare the county value to the state value as well as the US value. So you get a lot of information looking at the data by geography. Okay, and then the last, which DOH race ethnicity had the highest rate of managing household tasks for someone living with dementia among caregivers? So this is asking about caregiving. So we can go ahead and go down to our caregiving section. This is asking about caregivers who managed household tasks. So here we can see that indicator. And we'll click on it to see the detailed data. Again, we have a nice definition here. So household tasks can include cleaning, managing money, or preparing meals. Those are the examples that were given to the person taking the survey. And you can see here our value 23.1. It's not very different from the last one. This is again one that only has 3 data points, so it doesn't have a trend yet. But this question is asking about which race ethnicity had the highest rate. So we'll go ahead and pull up that chart, and you can see quite obviously that it is our Japanese residents who have the highest rate of managing household tasks for someone living with dementia among caregivers. So let me give you those answers. And again, thank you for your time. I do want to invite you to join us in June for our next coffee break webinar. On June 3rd at 11 a.m., we'll be exploring the latest data from the Pregnancy Risk Assessment Monitoring System. Mahalo.